Welcome to Navicent Knows Health. I'm Cindy Busby, and I'm here today with Dr. Wood Pope, board-certified orthopedic surgeon practicing here in Central Georgia, and today we're going to talk about his practice. Dr. Pope, thanks so much for being with me.
Well, thanks for having me, Cindy.
Could you let our audience know a little bit about the scope of your practice? You say orthopedic surgery generalist. Could you tell us a little bit about that?
Sure. I see young children from 3 to 4 to 5 years of age all the way up through end-of-life issues. Oftentimes it is trauma-based, injuries, fractures. Oftentimes it's overuse. Oftentimes it's wear and tear, arthritic conditions of the body.
Mm-hmm. When we talk about wear and tear, what kinds of diagnoses are you seeing in your office? How do patients normally present with pain in their joints?
Well, usually folks have had pain, sometimes even swelling in a joint, shoulder, elbow, hip, knee, foot, and ankle. Oftentimes folks have dealt with it for a period of time, sometimes a few weeks, sometimes a few months. Oftentimes they've even tried some over-the-counter type medicines, anti-inflammatories and whatnot. And usually folks present because their symptoms fail to resolve.
When we talk about accidents, you mentioned how someone might come in with a fracture. We have your trauma-related injuries, big accidents. How are they coming into your office? What kinds of accidents do they present with? What's their path to your office after a fracture?
Sure. So, it's anywhere from the slip and fall and an ankle sprain that gets seen in the emergency room and sent to us to be evaluated 5 to 10 days later. Oftentimes it's more high energy injuries such as fall from height, or even in this part of the country we're dealing with all-terrain vehicles and four-wheelers and motorcycles and side-by-sides, and so if someone were to have an injury like that, it's not life-threatening. Oftentimes they'll go to their primary care doctor or even an urgent care, and then they're sent to us for follow-up.
What's the first conversation like when you're evaluating the path they might take, starting with something you might prescribe there to eventually having surgery?
The vast majority of folks we see have conditions that we can treat typically without surgery. Oftentimes, as I mentioned before, that they've attempted some sort of treatment prior to seeing us, whether it be anti-inflammatories or ice or just activity modifications. Oftentimes we evaluate them, we ask what they've done, how they potentially injured this, or if this just began without a particular injury, and the things that make it better, the things that make it worse, and typically examine the patient, oftentimes even x-ray the joint involved, and go over kind of some treatment options. And those treatment options range from anti-inflammatories or even bracing, sometimes physical therapy. Occasionally your judicious use of injections sometimes can help. And then if all of those things fail and someone's still hurting, they're still having interruption of daily activities or pain at night that interrupts sleep, then sometimes we do talk about further treatment with surgery.
We talked about you being an orthopedic surgery generalist, so you treat foot and ankle, hip, knee, elbow, shoulder. Tell us a little bit about some of the technology that you use around knees.
As far as pre-operatively, we're using advanced imaging, sometimes ultrasound, certainly MRI and CT scan. Sometimes that allows us to come upon a diagnosis that previously we were not able to. As far as surgical technology, often robotic surgery is what we're dealing with more commonly now, helping us with placement and sizing of implants with both partial and total knee. And that technology ideally allows us to be more precise surgically, which hopefully will help improve overall outcomes and potentially even shorten recovery periods.
When it comes to doing total hips, talk about some of the ways that patients can expect their outcomes to be. I mean, we talked a little bit about the fact that it can be so life-changing for patients. Can you tell us a little bit about the technology you use for hips and the outcomes that you see with your patients?
So hip replacement is probably the most successful surgery, in my opinion, in orthopedics. Success rate is extraordinary. 98–99% of folks have pain relief and functional improvement and are extremely satisfied. There have been several different ways to do hip replacement. in the last 30 years. The one we hear about most recently is the anterior hip. That's been around for a long, long time, however. But it's come more in the forefront here recently in the last 5 to 10 years, with the thought being that maybe it speeds recovery. And so we're doing hips anteriorly in the right patient based upon their bony anatomy and their overall shape of their body. But we're also doing them posteriorly as well, and they both recover extremely well. Folks typically are up walking the day of surgery. Oftentimes we're doing this under what we call a spinal anesthesia, where you're numb from the waist down and just sedated. And once the spinal wears off, you're able to get up and walk with a walker, and oftentimes folks use a walker for 5 to 10 days and then transition to a cane. They're typically using a cane a similar length of time, another 5 to 10 days, and usually by 3 to 4 weeks folks have already ditched their cane and they're back walking for exercise.
When we talk to patients about orthopedic surgery, particularly hips, there's a lot of anxiety around pain control. What are some of the ways that you address that with the patient prior to surgery, and then also with the way you address pain after surgery?
One thing that I tell patients is the more they hurt preoperatively, it's almost counterintuitive. The more they're hurting preoperatively, the less they seem to hurt postoperatively. And so folks that have zero pain preoperatively, I get a little nervous about managing their symptoms postoperatively. And sometimes if you're having zero pain, maybe you shouldn't have surgery. But there's what we call enhanced or rapid recovery protocols now that we're using, and also injectables that we inject about the hip that sometimes can lessen pain dramatically. And hip replacement in particular seems to be one, for whatever reason, folks tend to hurt, only for a very short period of time. So folks tend to do real well with it.
Of all the specialties you could have focused on as a physician, why did you choose orthopedic surgery?
Well, I chose orthopedics for a couple reasons. One is the field itself is technologically advanced and advancing. Folks tend to get well quickly. There are definable problems that are correctable, either surgically or non-surgically. And so oftentimes I'll see folks in the office on follow-up, and it's not uncommon at all that 50, 60, 70% of your folks you see that day are folks that you've gotten well. And they're here to say thanks so much, and I'm back to where I was before.
Well, thank you so much for telling us more about your practice.
Sure, thank you for having me.
Well, thank you, and thank you for watching Navicent Knows Health. If you'd like to know more about Dr. Pope and his practice, please visit us at navicenthealth.org.